Hi, I am a hospital relation manager and I've been working with Dr. Lewis for the past 3 years. Today, we're gonna share some feedback about the usual questions that we get from patients who are going to be treated for temporal mandibular joint, TMJ, or other procedures. The first question that we get is why this is not a surgery if we have to stay in the hospital and go for general anesthesia. Well, this procedure is not a surgery because it's minimally invasive. There is no cut, no stitching. It's actually Dr. Lewis' personal technique modification with cutting-edge technology instruments that only he does in the UAE and very few in the world. So since it's not a surgery, avoid confusion with insurance coding and treatment descriptions for approvals because they use a different terminology. Another question that we get is, why do we need to stay in the hospital if this procedure is not a surgery? Well, you will have to stay in the hospital for observation and to let us contribute to a faster recovery. You will be monitored by the doctor and you will receive a 24 hours exquisite patient ward service with all comfort. Surgery means open cut, and this procedure is not. Not all hospital procedures are surgeries. Another question that we get is, why do we need general anesthesia if this is not a surgery? Well, for your safety, for your comfort, make it pain-free, and let us provide you with medication inside your bloodstream for faster recovery. Nowadays, general anesthesia, it's a conventional procedure with close to zero risks. Another question that we get often, it's about the recovery. How painful, how fast will it be? Well, it's not going to be painful. In most cases, it's not, because safe and effective medication will be used. And it's going to be very fast recovery. After the treatment, you might experience just some moderate discomfort, very slight inflammation, but that's pretty much it. The feedback that we get from our patients after the treatment is the improvement. All of them come back noticing a definite improvement after the treatment. With regards to sick leave, we can provide from 3 to 5 days, and that's entirely up to you. However, most patients, they resume their activity already on the first day after the procedure. Many patients are also concerned about how long it's going to take for them to eat and to walk again after the procedure. Well, as a general guideline, 2 hours after the procedure, you can resume drinking and eating soft food. And on the following day, you can start your regular activity again and resume your regular diet. Whereas for sports, we usually advise patients to wait for 3 days after the procedure.
For my patients. And thank you for your help. Continue.
Thank you, Dr. Lewis.